everyone, welcome to It's Healthy Mansion channel. So today we are going to see another part 2 video of HSG film interpretation. Today we are going to see a fallopian tube abnormalities, how to see abnormality in an HSG film with respect to the fallopian tubes. So we have two fallopian tubes in female, right and left. Always it is the right side when we are looking in front, and this is the left side. So this is a normal fallopian tube. How the normal fallopian tube looks like? It is a thin, smooth and regular. There is a free spillage when the dye has been inserted in the uterine cavity. This dye travels towards the fallopian tube and this comes out from the femoral end of the fallopian tube. So whenever the spill comes out from the fallopian tube, it is said as spill positive. And whenever the spill you can't see coming out, it is called as spill negative. So let's see the fallopian tube abnormalities. So the first abnormality of the fallopian tube is proximal or cornual block. So in this image, you might see as uterus consists of two cornua. So here the right side, I have showed the diagrammatic image showing cornual as well as proximal block. So here you may see over the right side there is a cornua, means there is a no spillage after the cornua of the uterus. So here there is a block. As you see, there is no spill. So it is the cornual block. This is a diagrammatic interpretation. We are going to see HSG film also, and you will understand in very easy way when you connect these diagrams with the HSG films. Now here you may see little above or little more far, there is a proximal block. Proximal block, like more towards the fallopian tube or femoral end. Whenever you go, there might be a proximal block but little far from the cornua. So it is when there is a block, the block may be adhesions or any kind of fibroids or any kind of block. You may see any kind of, we don't know right now. So in HSG we don't know exact what is a block. So whenever you see some kind of block and when there is a no spill from the this side, that is the left side, you may say this as a proximal block. Now next we are going to see is the mid-tubal block. So I have divided the into two parts. Let's example, it is a right tube and this is a left tube. First, the spill is going in the right tube. Here you may say it is far from the cornua as well as the proximal part. It is a midline, that is a mid of the fallopian tube. That's why whenever there is a block and there is a no spillage, if you see there is a no spillage here over the right side, it is called as mid-tubal block also. Sometimes you may see some dilation, some swelling, some inflammation over the mid-tubal. It may be infection collected with pus, Hydrosalpinx or Hydrosalpinx. This, and when you see there is also no spillage, this may be called as mid-tubal block with mid-tubal dilation. Here there is no dilation. This helps to diagnose the pathogenesis of the fallopian tube blocks. Little for the diagnosis, differential diagnosis, but not exact diagnosis. Now next is distal terminal block. Here the same, I have divided this into two parts, that is right fallopian tube and left fallopian tube. Now first we are looking at right side, the fallopian tube. Here the spill is passing from the right side and you may see here this is a femoral end, this is a cornua, this is a proximal, this is a mid-tubal and this is a femoral end. As you see, there is no spill in the femoral end. So this may be called as distal or terminal block because it is a terminal as well as it is distal to the uterus. Now we are going to see the left. I have shown here the left as I shown in the mid-tubal block also. In left also the terminal block, it is swollen, it is inflamed. So this may be a Hydrosalpinx or Hydrosalpinx. It is dilated. So there is a no spill here also. So we may call as distal and terminal block. So you will see here with no dilation, with dilation. You may compare, but there is no spill here. Now next is the beading appearance. The beading appearance, it is mostly seen in tuberculosis and salpingitis, where the fallopian tube structure is irregular with some kind of bead when the spill passes. I have divided this into two parts, right side and left side. Whenever the spill passes from the fallopian tubes, you may see some beads, some small circular beads here when there is a no spill also. Sometimes in some patients we see in their HSG films like there are some beads but there is spill present. So you have to note this with spill present or spill absence. Whenever you want to diagnose any pelvic tuberculosis in the HSG, you might see in uterine abnormality also that some bead-like appearances is seen in the uterus also. This thing we have explained in part 1 in the uterine abnormality. Now, next fallopian tube defect is hydrosalpingx. In hydrosalpingx, sometimes we may see the spill and sometimes we may don't see the spill. That is, the spill is absent. Like again, I am dividing this into right and left. Here you may see there is a proximal as well as mid-tubal dilation and spill is seen. Spill is seen even though there is a dilation. And even left side there is proximal dilation as well as terminal dilation, but spill is absent. So you have to interpret the HSG correctly and properly, even though you have to look at the spill of both the fallopian tubes. Now sometimes people get confused, like are these structures are normal in fallopian tube? You may see some HSG films which are like this, like example again right and left. You may see sometimes the spill is passed and you may see that the fallopian tubes are not exact in their structural position. You may see this may be pulled upwards. So this is sometimes normal, but if that person is suffering from long lasting infertility, like chronic infertility more than 3-4 years, so it may be laparoscopic correction may be needed. Now next, here the left side you may see the fallopian tube is curled upon itself. It is also a normal thing because the spill is positive here also. Sometimes the fallopian tubes round upon itself you will see in the HSG. So this is also normal. Hope so you have understood this diagrammatic. Now let's see the HSG film and let's together interpret. So this is the first HSG we are going to see. It is a normal HSG where you will see a normal uterine cavity with having right side and left side fallopian tube spill plus. The dye is positive because the dye spillage has been seen. So here you may see a abnormality in this HSG film. Yes, you are correct. We see there is a right cornual block because over the right side there is no spill. There is no spill edge is seen, whereas in left side there is spillage is present. Now this HSG film says that if you see over the right side, you may see there is a mid-tubal block. That is, after mid-tube, there is no spillage of the dye. Whereas over the left side, you may see the spillage is positive. And this is a normal uterus. So this is the last HSG film. Here if you see over the right side, there is terminal, that is terminal or distal dilation, and there is spill is seen. But if you see over the left side, there is terminal dilation, but there is spill is absent. So you have understood this topic. Thank you for watching.